So get moving. If you have no time for exercise, you better reserve a lot of time for disease. Benefits of walking. So daily. It reduces the risk of breast cancer by up to 60%, depending on what you read. 20%, 30%, 40%, 50%, 60%. Increase macrophage or anti-tumor activity. Stimulates the immune system. Increase growth and healing hormones. Decrease stress and body breakdown hormones. Decrease body fat, obesity, and weight gain. It's like chemotherapy without the side effects. So this one's exercise. Kind of just review. It'll reduce waste products, so it'll move things through your bowels faster and less exposure to any carcinogens. It promotes insulin efficiency, which decreases the risk of all diseases. It'll boost your immune system by increasing all the white blood cells and lymphocytes, interleukin, neutrophils. And exercise also raises the level of high-density lipoproteins for people with cholesterol problems. And then the more muscle mass you have, the more fat you burn. So you want to decrease the amount of fat. It decreases your risk of cancer. So unfit men and women who are 300% more likely to develop cancer. And the study concluded that half hour of exercise several days a week can dramatically lower your risk of cancer. So what is the relationship between physical activity and breast cancer risk? So this was another study. Most studies indicate that physically active women have a lower risk of developing breast cancer than inactive women. However, the amount of risk reduction achieved through physical activity varies widely, between 20 to 80%. And then down at the bottom, most studies suggest that 30 to 60 minutes per day of moderate to high intensity physical activity is associated with a reduction in breast cancer risk. Exercise lowers insulin. Lowering levels of insulin and insulin-like growth factor 1 improves the immune response. So what's your motivation? Do you want to just avoid cancer, or do you want to be inspired to exercise? And this one is a chart out of the same book, Anti-Cancer, and he measures a metabolic equivalent. So 1 MET is defined as the energy it takes to sit quietly. So for breast cancer, there seems to be a measurable effect after 3 to 5 hours a week of walking at a normal speed, or 9 METs a week. This is a picture of Tai Chi.